Hi, my name is Neil Zigerlicki, the CEO of the La Crosse Area Chamber of Commerce. I want to personally thank our members for being engaged members of the Chamber. I also want to thank our members for all the wonderful things they are doing within our community, especially during this tough year. Today, the La Crosse Area Chamber of Commerce is bringing you a Q&A session in partnership with the La Crosse County Health Department. Nicole from the County Health Department is here to answer questions regarding the newly updated COVID-19 guidelines. Hi, Nicole. Thank you for taking the time today to walk through our questions and provide clarity on the guidelines, as well as the updated guidelines that have come out in the most recent weeks. We are thankful for this opportunity to answer some of our employer questions.
Hi, thanks for having me today. As you already said, I'm Nicole Craigness, and in my pre-COVID life, I'm one of the health inspectors for La Crosse County Health Department. We know that there's been a ton of changes this week regarding the new DHS quarantine guidelines, so I'm happy to take the time today to answer some of those and clear those up for our local businesses.
Nicole, we appreciate your time, and let's get started with our first question.
Okay.
Does an employee need to quarantine if they've already had COVID-19?
So if an employee has already had a lab confirmed COVID-19 test in the last 90 days, they don't need to continue to quarantine if they've had additional exposures, if it's still within that 90-day time frame.
Perfect. Our second question that we have received is, who is considered a close contact?
Sure, so this is a little bit of a longer one. A close contact is someone who has been within 6 feet of somebody with COVID-19 for 15 minutes or more total. And those 15 minutes don't have to be consecutive. So if somebody had 5 minutes here, 5 minutes there, and 5 minutes a third time, those small periods would count if it's more than 15 minutes. Another scenario is that somebody had a direct exposure to a cough, a sneeze, or another body fluid. For example, maybe contact with a dirty tissue, sharing a drinking glass, shared food, towels, or personal items. A third scenario is somebody had direct physical contact with someone with COVID-19. An example of this may be a hug, a kiss, a handshake. Another is someone who stayed overnight for at least one night with somebody with COVID-19. So those are the different scenarios of when someone would be considered a close contact.
Perfect. Thank you. That's a great answer for our employers to know, and it's a great way for them to ask questions of their employees if they are COVID positive.
Yeah, one thing I didn't add, but I should add, it doesn't matter if either of the people are wearing a mask. Wearing a mask does reduce the risk of transmission, but it doesn't completely negate it when it comes to close contacts.
Thank you for that clarification. Our next question is, when can an employee come back to work?
Sure, so there's a few different scenarios for this too. And I know that today we're kind of trying to focus on close contact quarantine guidelines. But if an employee does have a confirmed COVID-19 case, they can come back to work when at least 10 days have passed since their first symptoms appeared, and then 24 hours has passed without a fever, without the use of any medication, and other symptoms have improved. Now, if somebody is considered a close contact, this is where the new quarantine guidelines come into play. So when we talk about close contacts and shortening a quarantine, it's really, really important for us to consider that our department still recommends 14 days as the recommended timeline. It's the safest way to ensure asymptomatic transmission. So we continue to recommend 14 days. However, with new guidance, there can be a shortened quarantine if all of the following can be followed by a close contact. So they have to be able to wear a mask at all times, ensure they can stay 6 feet from others at all times. They have to continue to monitor their symptoms for all 14 days. So if they can do those things, then they can get a test on day 6 or 7, and they can come back after day 7 if their test is negative and they have no symptoms during that quarantine period. A pending test on day 7 isn't sufficient, so they have to have a resulted test. And the test can be collected, like I said, on day 6 or 7. They have to continue daily symptom monitoring for up to 14 days, and their employer also has to have active monitoring. If they're not able to get a test in that time frame, they can come back after day 10 without testing if they have no symptoms, and they can continue to do all those other non-pharmaceutical interventions or NPIs that I mentioned earlier.
Perfect. Nicole, I want to jump ahead to a question that we had, which is number 6 on our list, because I think it ties in really well.
Mhm.
What does my workplace or an employer need to have in place to allow an employee to take the shortened quarantine and then come back to work?
Yeah, that's a great question, and one that we've been getting a lot recently. A shortened quarantine isn't appropriate for every workplace, and some of the things that they need to have in place, they have to be able to ensure that they have an active monitoring system in place for their employees. So they're asking their employees to check those symptoms, and they're recording them every single day until the 14th day of that person's exposure period. Additionally, they have to be able to ensure physical distancing at all times. So they have to have something in place that keeps everybody 6 feet apart. And like I said, that might not be realistic for some places because due to the nature of their work, they have to be in close contact with others. They also have to require masks or face coverings for all of their employees. They have to have regular environmental cleaning and disinfecting. We have some great CDC resources for that as well. And then they have to have a written plan to ensure that if an employee does develop symptoms in those 14 days, they can easily contact trace every other person that they've had contact with.
Perfect. Thank you very much for the detailed answer and the clarification. I know a number of our members have been wondering and asking, especially over the last week. So thank you.
It's a lot to wade through with these new requirements. We understand that.
It is, and that is exactly why we're having this discussion today. I'll jump back up on our list and go, when can an employee be tested?
Sure. An employee can be tested anytime they have symptoms for COVID-19, and they can do that through a local healthcare provider by calling the nurse line, or they can go through a community testing site. But if they don't have any symptoms, our healthcare systems right now don't have the capacity to test those people. So we recommend they go through a community testing site. And if they're able to get that shortened quarantine after talking with their employer, they can get tested on day 6 or day 7 for it to count towards their 7-day shortened quarantine.
You touched on community testing sites. Where can someone be tested at those community testing sites?
Yeah, so we have, I think, 3 or 4 per week right now locally in La Crosse County. And those are on our website at lacrossecounty.org/COVID-19. We do try to update those weekly. So like I said, there's about 3 or 4 of those per week that people can utilize.
Perfect. All right. So I want to go through a little bit more of a clarification. And I know that you touched on this, but can my employees return to work after 7 days?
Sure. So an employee can return to work after 7 days, which is actually on day 8. So we have to remember that the exposure date is day 0. So really they can come back on day 8 if they've received a negative COVID test and they've had no symptoms at all. And they can follow all of those NPIs that I talked about earlier. So physical distancing, mask wearing, and symptom monitoring for all 14 days. If they're waiting for a test in that time frame at day 7, they haven't got their results back yet, they need to continue to stay at home until their test result comes back.
I know that most people probably know the symptoms already, but please give us a reminder again of what those symptoms are and what employees should be looking for.
Yeah, absolutely. So the most common ones are going to be a fever, a cough, shortness of breath, fatigue. A lot of people have said that they are getting headaches, muscle aches, loss of taste or smell, a sore throat, and then some GI symptoms like nausea, vomiting, or diarrhea. And we're still learning about some of the other symptoms. There can be others, but those are the main things that we would like employees to monitor themselves for.
Perfect. Thank you. One last question, which is number 7 that we talked about on the list earlier.
Yeah.
Is there any businesses that should not adopt these shortened quarantine measures, or does the shortened quarantine apply to all business?
Yeah, so I think we did touch on it a little bit earlier. Businesses that can't facilitate all of those prevention measures that I mentioned earlier should not adopt the shortened quarantine measures. For example, if the nature of a business would require that an employee is in close contact or within 6 feet of patrons or other coworkers in order to perform their job duties, then that would not be an appropriate time for that workplace to shorten a quarantine, and we would still recommend the full 14 days.
Perfect. I think that is one major question that our members have had,
Yeah.
and that is a great clarification. It looks like we've gotten through most of our questions. Is there any other updates from the health department that you'd like to give to our chamber members?
Yeah, sure, absolutely. I think one of the most important things is we just want to say thank you. Thank you for reaching out and asking these questions and getting some clarification, because we know these guidelines and guidances can be really confusing to wade through, and we really appreciate the opportunity to try to answer and clarify those for each of our community members. Additionally, we did update our business guidance toolkit on our website, and that's going to take people through basically every single COVID-19 scenario, a positive employee versus a close contact employee and what to do next. And it also has an appendix with all of the contact tracing resources that a workplace may need. So that's available as of this morning on our website. We just updated that with the new quarantine guidance. So if people want to download that and use it, absolutely do that. And then if people ever have questions, they can email us at covid19@lacrossecounty.org or call our call center directly at 608-785-6240.
Perfect. Nicole, thank you for your time today. Thank you for the clarification. Thank you just to the county health department on being such a resource for our business and trying to get the information out as soon as possible. We cannot thank you enough. I know our chamber members are appreciative, and your work is not going unnoticed. So thank you
Thank
very
you. Well, thanks, and let us know if you have any questions.
much. Okay. Thanks again, Nicole, and chamber members. Thank you for the time today. If you have questions, you can email the chamber or you can email the county health department. Thanks for your time.
Yep, thanks. Have a good rest of your day.